you are listening to Dr. Huma Ibrar, and today I am here with a very important topic, that is Parkinson's. And I will explain this topic in a very easiest way with mnemonics. So stay connected and watch this video till end. Starting with the introduction to Parkinson's disease. Definition: a chronic progressive neurodegenerative disorder primarily affecting the movements. Now, key neurotransmitter here is dopamine, and there is the deficiency of dopamine. Affected area is basal ganglia, substantia nigra, and mnemonics to remember the key factors of Parkinson's disease is DOPA, D, dopamine deficiency, O, onset is gradual, P, progressive, A, affects movement. Moving towards the causes and the risk factors of Parkinson's disease. It's idiopathic, most common, genetic mutation, PARK1 and LRRK2, environmental toxins including pesticides and heavy metals, plus brain injury or oxidative stress. So there are four key causes or risk factors of Parkinson's disease. Here are the four risk factors or causes of Parkinson's disease: idiopathic, genetic mutations, environmental toxins, and brain injury or oxidative stress. Moving towards the classic motor symptoms and mnemonics to remember the symptoms are trap, tremors, rigidity, that is cogwheel, akinesia, bradykinesia, slowness of movement, postural instability, that is latest sign. Non-motor symptoms include cognitive decline, depression and anxiety, sleep disturbance, autonomic dysfunction, including constipation and hypotension. Now, let's talk about the stages of Parkinson's disease on an Yahr scale. Number 1 stage include unilateral involvement. Number 2 include bilateral no balance issues. Number 3 include balance impairments still independent. Number 4 includes severe disability, needs assistance. And the number 5 includes wheelchair bound or bedridden. Now, what's the assessment tool for PTs to follow? UPDRS, Unified Parkinson's Disease Rating Scale, Timed Up and Go Test, TUG, Book Balance Scale, 10-meter walk test, Functional Reach Test. Now let's talk about the physiotherapy goals. Goals include improve mobility and balance, reduce risk of falls, enhance functional independence, and maintain flexibility and posture. Physiotherapy interventions include mnemonic to remember the physiotherapy interventions is B, fit, B, balance training, E, education and energy conservation, F, flexibility and stretching, I for intensive aerobic exercise, and T, task-specific training. Now, cueing strategies and techniques include visual cues, lines on floor, auditory cues, metronome and music, rhythmic initiation, and use of external focus to overcome freezing. Let's talk about the assistive devices and patient education, use of canes, walkers with laser cues, importance of home safety, encourage group therapy and social activities, regular follow-ups, and caregiver education is very important. Now, what's the prognosis and multidisciplinary team? There is no cure for Parkinson's disease, but symptoms are manageable. Team that will manage the Parkinson patient include neurologist, PT, OT, speech therapist, and psychologist. Now, what's the summary of Parkinson's disease? To remember the summary of Parkinson's disease is mnemonic is Parkinson, P, postural issues, A, akinesia, bradykinesia, rigidity, R, K, keeping balance impaired, I, instability, N. Non-motor symptoms. S. Substantia nigra degeneration. O. Overall decline. N. Needs PT support. Let's move towards the MCQs, brainstorming MCQs. Number 1 is most effective cueing strategy to improve gait in Parkinson disease. Option A is passive stretching. Option B is visual floor markers. Option C is electrical stimulation, and option D is cervical traction. I want your answer, or I want your correct option in comment section. Number 2 MCQs is a 65-year-old Parkinson patient complains of freezing during walking. Your best intervention would be option A, ask him to walk faster. Option B, use auditory rhythmic cueing. Option C, advise complete bed rest. And option D is start strength training only. And I want the answer in comment section. Thank you for watching this video. Subscribe for more important lectures and follow me in YouTube and Instagram. Like, share and comment your doubts.